basically said much of the things. It's a lot of misinformation in terms of the influenza. Basically, we have two main viruses, influenza A, influenza B. I want to point a difference between this year and last year. Last year, in difference to what we're seeing this year, is we had more influenza B than influenza A. At this time, more or less in January last year, we had a decrease in the number of cases, which is usually unusual. January and February are usually the month where you start seeing more cases. That was an unusual behavior. So we are seeing right now the usual behavior of the influenza virus. And we expect to see actually a little bit more cases during the next weeks because that's the usual behavior. We need to remove from the vocabulary the word epidemic, pandemic, because those are not correct words. So it's very important for the media to clarify that we're not an epidemic. We are really below the threshold to be calling this even close to an epidemic. The most important thing that will be very important for the media to pass to the general public will be they need to get the flu shot. This is something that we can prevent. The flu shot contains the H&N1, which is the subtype that we're seeing that predominates in this season. Okay? So it's very important to pass that message. People will not get influenza by a flu shot. This is something that we need to make sure that people understand. It's a very simple flu shot. Side effects are there like any other. You can get a little bit of fevers, you can get some body aches, runny nose, but those are temporary symptoms. They will go away, and definitely it's a very minimal side effect in comparison with the complication that someone can get because of influenza. Influenza, if it's not treated, especially on time, with some populations, especially pregnant, like Dr. Gonzalez mentioned, pregnant patient, toddler less than 2, older than 65, people with heart conditions, people with liver disease, people with kidney disease, HIV, cancer. Those are potential people even with BMIs. We know as a fact, like people with body mass index of over 40, which is considered morbid obesity, those are people who are prone to get more complications. So we really need the media to pass a message that people need to get the flu shot. This is something that we can prevent.